Lab 1 blood pressure assessment for resting blood pressure.
Materials needed will be a stethoscope and a sphygmomanometer. Important for subject to have their back supported, their feet on the floor, and their arms supported at heart level. Earbuds of stethoscope should be facing outwards. Diaphragm on stethoscope must be twisted, and make sure to tap diaphragm to make sure you hear noise. Dial and pump all the way to the left will be loose, and a dial all the way to the right will be securely closed.
Cuff should be put on left side on bare skin.
It is important to align cuff with brachial artery. Wrap cuff firmly around upper arm at heart level, and the bladder within the cuff should encircle at least 80% of the upper arm.
It is important to have the appropriate cuff size to ensure accurate measurement of resting blood pressure.
For assessment, patients need to be seated quietly for at least 5 minutes and must refrain from ingesting caffeine or smoking cigarettes 30 minutes prior to blood pressure assessment.
Stethoscope chest piece must be placed below the antecubital space over the brachial artery. Cuff pressure should be inflated quickly between 180 millimeters of mercury to 200 millimeters of mercury. Then slowly release dial to left by 2 to 5 millimeters of mercury per second to release pressure. As pressure falls, you will then hear the first or second Korsakoff sound, and this will be your systolic pressure. And before sounds end, you will hear the last Korsakoff sound that is almost faint, and this is your diastolic blood pressure. For accurate measurement, perform this assessment twice, but assessments must be a minute apart and then calculate average of both readings. Once blood pressure methods are recorded, please refer to the table to determine patient's blood pressure classification. Patient in video had a systolic blood pressure average of 110 and a diastolic blood pressure of 70. Her blood pressure classification is normal.